We're constantly learning about COVID-19, and we know you have a lot of questions. Hundreds of you have been texting in your questions. Our 9 Health expert, Dr. Payal Kohli, is back with us this morning to answer some of them. Good morning, Dr. Kohli. Thanks for joining us again.
Good morning. Thanks for having me.
So the first question comes from a viewer, and a lot of viewers asking about going to the dentist. So this particular viewer asks, what will it be like to go back to work in a dental office, and what can I do to best protect myself?
You know, the workers in a dental office, Natasha, are the ones that I worry about the most, actually, perhaps even more so than the hospital workers, because they're working in very close contact with the patient, whether it's a dental hygienist or the dentist themselves, and they're in contact with the respiratory secretions, particularly the droplets like saliva that we know contain viral particles. So I would strongly recommend that if you're working in a dentist's office and have direct patient contact, that you really do head-to-toe PPE, and that includes an N95 respirator, so don't settle for the surgical mask because you're coming into very close contact, a face shield, a goggles, a full gown, and then of course gloves. And it's really important to make sure that you have adequate supplies of those before you start working in a dentist's office doing procedures such as dental cleanings or other dental work.
Our second question comes from a viewer named Debbie in Greeley, and she wants to know, if a person is asymptomatic for COVID-19, how long will they be that way, and will it ever go away like those who recover from the virus?
So Debbie, what we know about asymptomatic people, we mainly are extrapolating the information from symptomatic people. But what we know is those with symptoms usually tend to be infectious or giving off the virus somewhere around 2 weeks or so, but it can be as long as up to 4 weeks. So we think the same applies to asymptomatic people, where it's about 2 to 4 weeks where you're actually infectious or risk to others. But the challenge is we don't really know when the clock starts on that because you're not having symptoms. So we don't know exactly when to start that 2 to 4 week clock. And that's why we're telling everyone to wear masks when they leave their home, to just sort of assume that they have the virus or they're one of those asymptomatic spreaders. Now, what else we know about coronaviruses is that they don't tend to live inside our body forever, like the chicken pox does, for example. So other coronaviruses that cause the cold, you know, you're infectious for a few days and then they go away. So they don't chronically infect us.
Yeah, and a third question, and I cringe a little reading this. A viewer wants to know if inhaling a mist or vapor of hydrogen peroxide can help kill COVID-19 in the lungs without damaging the lungs.
Yeah, that was an adequate response because I definitely cringe with that as well. And the answer is no, absolutely do not do that, because there's no evidence that it's effective at inactivating the virus, which, remember, lives in your nose and mouth and your lungs. And there's a significantly high risk that you'll have what's called a chemical pneumonitis, which is a chemical inflammation of the lungs, because the lungs are not supposed to see that kind of material, and they could have a severe inflammatory process that could actually paradoxically increase your risk for having a pulmonary complication or contracting COVID-19.
Okay, so no to inhaling hydrogen peroxide. Good to know. Dr. Kohli, thank you so much for joining us and answering those questions.